Hey guys, how's it going? Your real quick discussion about asthma and these medications. Isn't it sad that people who have asthma, some of them, when they just don't use their inhalers like what the way they're supposed to, they start getting frequently short-winded and having to go to the emergency room back and forth. All because they're just not using their medications. If only they use their medication like what they're supposed to, then they wouldn't have these asthma exacerbations. So in asthma, you can have the asthma where you wheeze a little bit, and then you end up with asthma exacerbation where you're wheezing terribly. It's asthma that just gets suddenly worse. And so what are the things that can exacerbate an asthma? Like bad allergies. People who are allergic to dog, when they suddenly come across an allergen or dust allergy, or when it's really getting cold outside and they go to expose themselves to cold, or acid reflux, because when the acid spills over into the lungs, that can actually start asthma exacerbation. So there are many things that can exacerbate asthma, and within asthma medication there are different kinds. The main treatment is steroids, okay, because what they do is it decreases inflammation in the airway, and then that way they don't wheeze anymore. And by the way, the wheezing is because the airway is constricted, and when air is trying to get out of the lungs, and because of the constriction, it creates this high-pitched noise, the wheezing noise. And if the constriction is significant enough, so when they're taking a deep breath, you hear wheezing even during inspiration. So some people have inspiratory and expiratory wheeze. It can happen both the times. And when they are on corticosteroids inhaled, in the past we used to give them pills long ago, but nowadays pills are not used because steroids can cause diabetes and blood pressure and cataracts and bone loss and all that, right? So if you can use steroids that are just inhaled at such a low dose, then why give them a pill, right? So nowadays, just inhaled steroids are used, but a lot of patients forget to just take the inhaled steroids and they end up with asthma exacerbation. That's sad, isn't it? And then on top of the steroids, there are a lot of other medication like short-acting beta agonist. It's called a SABA. Example is albuterol. That's a rescue inhaler. And then LABA, LABA, long-acting beta agonist. Example would be like salmeterol. And then LAMA, LAMA, long-acting muscarinic antagonist. Example would be like tiotropium. LABA and LAMA, they're added together and they help. So the pulmonologist would really use a combination of these medications to bring asthma under control, but the main treatment is steroids. I'll talk to you later in my next post, guys. Okay, hopefully this helped you. Goodbye.